Hello, my name is Jason Langley. I'm the content specialist here at Intelligent Fingerprinting. I'll be the host for today's webinar. Really appreciate everyone taking the time to join us today. Over the next 45 to 60 minutes, we're going to be exploring the world of fingerprint drug testing in depth and look at how it compares to traditional workplace testing methods. Today, I'm joined by two experts in the world. The first is Peter Paceris, Vice President of Product Development at Intelligent Biosolutions. Peter is going to provide us with some background on intelligent fingerprinting as far as science and technology goes, and explain a lot of how the science works. Peter, would you like to just say hi and introduce yourself for a moment?
Sure. Hi, everybody. My name is Peter Paceris, VP of Product Development. And yeah, we're very excited to be here today. Thank you for joining. Background is pretty much chemical engineering. Had 18 years in oil and gas, and then the last 4 years with intelligent fingerprinting, intelligent biosolutions. So we're very excited to be here, and looking forward to having a conversation.
Excellent. We're also joined by Doug Heath, the Vice President of Sales at Intelligent Biosolutions. Doug is going to share his expertise on fingerprint drug testing, talk about some of the pain points that organizations are facing right now, and he's also going to run us through a live demo today. Doug, would you like to say hello and introduce yourself?
Yeah, of course. Thank you, Jason. So I'm Doug Heath. I've been involved in workplace drug testing for upwards of 8 years now, providing solutions and helping businesses with their drug testing, health and safety needs through a variety of different methods and matrices. Previous to that, my experience is in international and global sales.
Perfect. So the goal of our session today is to highlight some of the key differences between fingerprint drug testing and other traditional drug testing methods. We also want to demystify some of the common myths around fingerprint drug testing and give you a little bit more of an in-depth knowledge on the straightforward practice of using fingerprint drug testing. With that, we can look at a quick overview of our agenda for today. We'll begin with overview of the intelligent fingerprinting history and a little bit about the technology. Then we'll dive into some of the traditional drug testing methods and their limitations and what organizations are finding, like what issues, sorry, they're running into with traditional testing methods. After that, Doug will walk us through a live fingerprint drug testing demo. And finally, at the end, we're going to have a Q&A, a bit of housekeeping before we start, just so that everyone knows the session is being recorded, and we'll share the link with everyone afterwards. Also, please feel free to submit questions in the Q&A box throughout the session. We'll address as many as we can during that Q&A segment, but if a question comes up later, or if we don't have time to answer your question during the session today, we'll be sure to share our contact details with everyone in the call today and make sure that we reach out to you directly. With that, I'll hand it over to Doug to outline a little bit about the history of intelligent fingerprinting.
Thanks, Jason. So I've been fortunate enough to be involved with intelligent fingerprinting from its inception as simply an idea, right the way through to the current day, where we're servicing upwards of 300 customers worldwide with thousands of our readers in the field, and it very much being a tried, tested and proving testing matrices. Early on, it was spun out from the University of East Anglia, just outside Cambridge in the UK, with a gentleman called Professor David Russell, who looked at a fingerprint and thought, what more can we learn from this as opposed to a biometric, a means of identifying a particular individual. Now, all a fingerprint is, and I apologize in advance on this webinar, I'm going to refer to sweat constantly for the squeamish people on here, but all a fingerprint is simply sweat. Anything that goes into our body is expressed in some way, shape or form. We may be familiar with urine, saliva, any other sort of drug screening matrices, and sweat is another viable method for doing that. So by ascertaining that the fingerprint is sweat, he thought, what can we learn from this sweat and what's within it? Now, over the course of the next 10 years or so, there's an enormous amount of R&D in developing the test and getting it to a point where it's a commercially viable product. And that sits in line with meeting accuracy of other proven methods, how we collect the sample, how we protect the sample integrity, and a heap of things that I will go through during the drug screening demo. But all that early work up front allowed us to build a system that could accurately detect whether people have ingested a substance and are therefore metabolizing it, and if indeed they're likely to have consumed an illicit or prescription substance just from looking at their fingerprints. In the early days, we worked alongside drugs rehabilitation partners. We did clinical trials and drug studies in the USA. We worked alongside the coroners, believe it or not, because even dead people express sweat. And we were able to sort of hone and develop this test through various different iterations. This led us to establishing a small market presence right when the COVID-19 pandemic arrived. Now, for those on the call that are familiar with drug screening as a whole and workplace drug testing, we know that to do any sort of method outside of fingerprints, so urine or saliva predominantly, became incredibly difficult in the pandemic. Getting people on site was hard enough. Having to remove those had a real impact on sort of your labour force and your workforce. And obviously collecting bodily fluids such as saliva or urine weren't two things that people were particularly keen on doing during a global pandemic where we're all particularly concerned around our own health as well as everybody else's. Now, one of the key benefits to fingerprint drug testing is the ease of use collection, and particularly the ability to observe how people do it from a safe and social distance. So no one outside of people operating COVID-19 tests particularly capitalized on the pandemic. But what we were able to do was provide a safe solution to ensure that workplaces continued, deterring drug usage and having a drug-free environment. And we placed a reasonable amount of readers with a number of organizations, from large drugs rehabilitation organizations that it was essential to carry out testing in this global crisis and ensure their service users are safe, from workplaces that need to continue driving that safety element. And that's really when things sort of started to turn a corner for the business, which, as I mentioned earlier on, is now up and running in real anger. The UK market continues to grow and thrive and makes up a large proportion of our business, but that's certainly acting now as a case study and a proof of concept for fingerprint testing as a whole. So within the UK, we provide to major players in each and every industry vertical, from the largest construction project in Europe to the largest home builders, construction companies, major airlines, a huge presence in the retail sector, and 2 of the 5 largest logistics providers in the UK as well. Now, that market is all well and good. And when I think of the global drug screening and drug testing market, I think the UK sits sort of second only to the USA in terms of volume of testing and attitude towards drug testing prevalence. Now, that is a small market. 80+% of the world drug screening market is the US. So with the UK sitting second, there's obviously this still huge other part to it. So what we've been doing is focusing on international growth. And we do that through a network of distributors placed all around the globe, from Chile in South America, Sweden, Scandinavia, Italy, Spain, Poland, and even sort of South Korea, UAE, Saudi Arabia, and then into APAC through Indonesia, Australia, and New Zealand. And as we go through that international growth phase, we look at opening new laboratories, hitting new markets that perhaps you weren't aware existed initially, and supporting everybody everywhere with this method, which isn't just applicable in one particular geography. All the benefits to fingerprint testing apply around the world, in some regions more than others, with things such as privacy. But the key focus is always to maintain and keep a safe working environment, which we're able to do through our technology. Thank you.
Sure. Thank you so much, Doug. Really great to see the growth and get a nice overview of, how we've evolved throughout time.
Yeah, definitely. And
Net,
I think, sorry, Jason, just to interject. I think that growth is really shown by the fact that we're selling into, upwards of 20 countries now through a network of 19 distributors. So it's a tried, tested, and proven solution that we're seeing grow in each and every sector now.
Great, thank you. Next, Pete, can you walk us through some of the science behind how this system works?
Sure. Thank you, Jason. So a lot of you may know this, but essentially the journey of a drug through the body starts at consuming the drug, right? So once you consume the drug then moves to the point of administration to the site of action, right? You ingest it, it goes down to the stomach, and absorption begins. Then distribution through bloodstream and other various tissues in the body start to absorb that drug. As that happens, metabolism kicks in. And once the metabolism kicks in and starts breaking down the drug, it starts to get excreted through sweat. Hence, your fingertips, as Doug mentioned, have a lot of sweat on them, making it a very good way of collecting sweat as an analyte and analyzing it for drugs.
Perfect. Thanks so much for the breakdown. I think at this point, it might be a good idea for us to take a look at some of the other testing methods. Just a quick overview and some of the criteria and problems that workplaces today are running into. Doug, can I have you talk a little bit about, well, first off here, the collection experience and what we're finding?
Yeah, of course. So when we look at workplace testing, there's sort of three key players that we need to consider. Urine, as we're all familiar, was the inception of sort of workplace drug testing. It was born out of the USA right after the Vietnam War, with a huge amount of people traveling back to the US with drug addictions from a particular region. Now, as the war finished, those people had to find a home in the workplace, and drug testing needed to step outside of the army. And it led into sort of mass workplace testing in the US. And originally that was all from urine. So urine's been around sort of the longest of any sort of workplace drug test, and is often viewed as the gold standard, with no sort of pun intended there. It's just the one that we're most familiar with. And, in an industry where there's serious ramifications, familiarization and an understanding of a technology often can give the perception of perhaps a higher level of accuracy, reliability, and any other thing. Outside of urine, the next sort of key player that we're going to sort of focus on would be saliva. Now, saliva testing arrived on the scene 15 to 10 years ago now. A slightly shorter window of detection than urine, and slightly easier to collect. All of these different sort of matrices have their own positives and negatives outside of the results. That shorter window, that ease of use to collect was one of those for them. But there is sort of various issues associated with that. The next one, which is sort of the new kid on the block, albeit having been operational for a while, is intelligent fingerprinting and fingerprint drug testing as being sort of one of the major players. And that's, of course, testing through sweat. Now, whenever we are adopting a workplace drug screening method or drug testing method, there are a number of things that I certainly believe that you need to consider. And the first sort of key one of those, I would say, would be that collection experience. So is this going to be a hygienic, dignified, and easy system to use? Because the key reason I believe the drug test is to deter people from taking drugs in the first place. If we're not deterring them and we're catching them, there's already been a risk. There's been an element of danger on site or in whatever sort of industry you're in. So we need to make sure that we're doing a volume of testing. And the only way we do a volume of testing is if we achieve these things. So with urine, for example, my personal belief is that it can be a simple process in an ideal world where there's a facility available for them to use. The particular individual needs to use the bathroom, and you have the same gender collector there to witness that sample. Because if a sample isn't witnessed and we don't know its validity, there's an awful lot of point in having done it. We're sort of trusting individuals, at which point you may well have just asked them. With saliva, aside from the COVID pandemic, which I just discussed, we're still swabbing people's mouths. We still need to enter their personal space, and it's still incredibly invasive to do so. Now, with certain drugs, they affect the amount of saliva we produce. Cannabis, for instance, can cause a dry mouth. And so gathering samples can often become difficult. And obviously, we put a lot of things in our mouth on a daily basis, and a lot of things can interfere with sort of the validity of those tests. So we need to do nil by mouth, which is incredibly inefficient from a time basis. We're sort of 20 minutes beforehand. And when it comes to the workplace, time really is money. With fingerprint testing, we're simply looking at the digits and gathering a sample. And we can do this anywhere, anytime, whilst being hygienic and certainly dignified. You know, we touch things and handle things each and every day. So considering that sort of donor experience at the beginning of your testing regime and that collection experience is an incredibly important step that we need to take.
Perfect. You kind of touched on this, but tamper resistance is also something that's really, really important to consider when you're testing, right?
Yeah, and I think this sort of falls into both ease of use, collection experience, and the overall result. Now, with drug testing, I think it's incredibly important to witness it. As I just sort of said, if we're not witnessing the validity of that particular test, that test integrity, we're reliant on the donor providing the sample. Now, obviously, drug screening tests have pretty serious ramifications in accordance to workplace policies or the governance of the country in which they're being taken, if it's in line with sort of a legal case of law, you know, police, military, anything like that. So we need the ability to ensure that the testing is being done correctly and nobody's attempting to manipulate the test. The drug screening market worldwide is worth many, many billions, upwards of 80 billion. The market for cheating drugs tests is a similar size, to show how serious people are about this. And if you're to Google sort of urine or saliva and how to cheat, you're going to find a wealth of options, from diluting samples through to fake appendages, but I'll leave that one to people's imaginations. Now, the ability to witness a test involves different things for different matrices. For urine, we would require a same gender collector, and we would also need someone to witness that particular individual to go to the bathroom, which is obviously incredibly invasive, and a heap of privacy concerns come into play. Before that, taps are often blocked off, and toilet cisterns are often dyed a particular colour. There's also temperature gauges on the tests to ensure that the sample provided is warm. So there's a whole scope of work before we even begin to gather a sample that would need to be taken place. With saliva, there's a recommendation for nil by mouth for 20 minutes before that sample's even taken, which involves no eating, drinking, smoking, chewing gum, or anything like that. Now, for every building site or every construction site I've been on worldwide, if you call 10, 15 blokes together to be tested, or women, the likelihood that someone puts on a kettle or someone lights a cigarette is pretty high, so it becomes incredibly time inefficient. But, you know, all of this needs to be done to ensure the testing integrity. With fingerprint testing, due to various sort of privacy, no privacy issues being involved, anybody can witness anybody do this, so it becomes incredibly difficult to tamper with. And as I go through the demonstration shortly, you'll see how that process takes place. And wherever you may have joined this particular webinar from in the world, you'll be able to see, hopefully, that I'm doing it correctly and not trying to cheat that test.
Next, we have on-site usability. I just want to add on to this. Doug, you mentioned something about the window of detection earlier.
Yeah, absolutely. So there is no drug screening system worldwide, or even drug testing system through to laboratory results, that's going to tell you that a particular individual is impaired. All any drug testing system is going to ascertain, is there a particular substance above or below a cutoff over a certain time frame, which is known as the window of detection. It's very different to alcohol. In the 80s, they put people on a racetrack, they plied them with booze and breathalyzed them and set what was the drink drive limit, which has its various different sort of levels around the world. And that's due to, ascertaining how impaired those people were. You can't do that with illicit substances for obvious reasons. It's not through a lack of volunteers, more sort of safety concerns and ethics in experiments. So we're just sort of reliant on that window of detection. That varies from system to system, from hair, and having needed a haircut, mine would be rather long right now, which is a literal lifetime of how long it took you to grow that hair. It's a timeline of drug usage, all the way down to blood, which is probably the shortest window in drug testing. Now, I haven't really referred to those in a workplace setting on the basis that, we don't get immediate results with hair, and blood's incredibly invasive with specialist training needed, so they don't tend to have a place in workplace. Now, the three contenders of urine, saliva, and sweat, which I mentioned earlier on, all have varying detection windows. So urine has a detection window of around 5 to 7 days. However, it's potentially much, much longer for something like cannabis because of how it stores in your bodily fat. If I was a habitual cannabis smoker, I would build up a reserve of THC within my fat, which I would then release for urine, potentially for months after I stopped smoking cannabis. So it could cause a positive on a test where arguably I would very much not be impaired at the time. Saliva is sort of 2 days or so much, much shorter. But, if I was to use a substance on a Friday night after work, come a Monday morning, I may well still trigger a positive test. And it varies slightly across all the substances on their panels. With fingerprint sweat, we sit in and around at 16 hours. And what we believe is the shorter the detection window, the greater the suggestion of impairment. So from a workplace testing standpoint, we're looking at, are you fit for work on a given day, as opposed to what may be your lifestyle. So if I boil that back to the breathalyzer analogy and the drink driving that I mentioned earlier on, if a breathalyzer worked like a urine test and I was pulled over, I provided a sample, I was positive because drug screens are positive or negative, they don't have a level. It looked back over a week. All that breathalyzer would say is, you've had alcohol in the past week. Now, am I safe to drive my car or am I not? We don't really know. However, with a breathalyzer work like a sweat test with that short window, we know I've had alcohol recently, the likelihood you want to reach in and take my car keys off me becomes much, much higher. So there's a real suggestion of impairment with a technology such as this. But in terms of how quickly we get results and if we can act on those immediately, that sort of all boils down to the testing method and how long it takes to do it. So, and I always look at this from a holistic process as opposed to a time to take a test process. So as I mentioned, in an ideal world, I might be desperate to go to the bathroom, provide a urine sample immediately, and go off on my merry way. However, we don't live in an ideal world. People don't always need to go to the bathroom. And, there's a huge amount of work in preparation for a urine test that's already taken place before we start, without dying of the toilet water, so on and so forth, blocking taps, taking facilities away from sites. My experience, people are reluctant to provide samples, and that's not always being bladder shy as well. I'm from the UK. If you can't guess from the accent, we have pretty terrible weather there. And on construction sites, if it's a rainy day in February, which is a particularly cold month, I'm called into the site office to provide a urine sample. I know you're going to keep me there until I do so. And so I'm going to sit with my feet up, being paid, drinking the cups of tea you give me to make me go to the bathroom, right until it's nearly time to finish my shift. So that whole delay for providing a sample makes getting the results pretty sort of ineffective. Now, with saliva, as I've mentioned, there's nil by mouth beforehand, but there's often issues with gaining a sufficient sample, purely down to the fact that, certain drugs cause dry mouths, so on and so forth. So it's really sort of keen to make sure we can get these results quickly. And as I mentioned, looking at the whole process, so is there a build-up beforehand? How long does the sample take to be given? And how long does it take the analysis? But looking at those as a whole, as opposed to individually, and what effect that has on the efficiency of your workplace. And I'll sort of cover off the fingerprint aspect of that when I go into the demonstration.
Yeah, talking about looking at holistically, I think that's a good point to talk about the cost.
Absolutely. So when it comes to a workplace environment, I would firmly sort of argue that outside of myself and Peter, who's joined me on the call today, none of us are paid to be drug tested. we're all here to do something else. You know, I demonstrate drug tests on a daily basis, which is why I make the argument that I'm paid to be tested. Now, we're all here to do another activity. It's important that when we carry out these activities, we're doing so safely. But health and safety in general is a cost to the business, and any time sort of taken where I'm not doing my job is also a cost to a business. And without being sort of too cheesy and cliche, time is indeed money. Now, when we look at costs for drug testing, it's important not just to look at unit costs. There's a wealth of other costs that need to be sort of accounted for within the process. So, of course, the upfront one is that unit cost. Outside of that, it's the time the whole process takes, from preparation of testing areas, unit cost after that, time taken for staff administering it, both the person you're testing and the individual conducting the testing, be it whether you're doing it in-house or calling them out, time taken for the results, time taken for any confirmation results, and also the cost of recruitment should your testing lead to that individual being dismissed. So, and when I refer to recruitment, I refer to sort of those longer detection windows where you're fishing with a larger net compared to the shorter detection windows. Something like a sweat test, which performs to a similar level of accuracy as urine and saliva, will detect less people than a urine test, not because of accuracy, purely because we're fishing with a rod as opposed to trawler fishing. So your recruitment costs, the ongoing costs of operating your business and keeping staff within it become less because we're keeping more people there and only detecting those that are unfit for work at those given times. So there's a wealth of things that you need to consider in terms of that scalability and operational costs, how quickly you can action upon a test. Have you got the facilities to do it? Do you need to call people out to do it for you? What are those call out fees? What are those lab fees? All of this feeds into the bigger picture as opposed to just a singular cost for that test. Now, at Intelligent Fingerprinting and Intelligent Biosolutions, we analyze this on a daily basis. Anybody that wants to know those, please refer to our website, our return on investment calculator, where we can include those costs, or please reach out to me afterwards and I'll happily sort of talk through that in a bit more detail as well.
Perfect. Thanks so much. I think that this is a really great point to pivot and to see what this looks like in action. I'll stop sharing my screen here, Doug, so that we can all see you as best as we can here.
Okay. Should I spotlight myself, Jason? Is that
Yes,
the best way to
please.
do this? Yeah.
Yes, please.
I think I've done that. If I'm large on everyone's screen. If I'm
You
not,
are,
I
thank you.
apologize. Right, fantastic. Maybe I should apologize for that as well. So when it comes to fingerprint drug testing, it's a very simple and easy process to do. And the best way for me to demonstrate that is to actually run a drug test on myself. So, which obviously, for obvious reasons, I'll be reluctant to do with any other drug screening matrix. I certainly don't have a habit of demonstrating urine tests on the internet. And I'm sure the attendance would be much, much less if I was to do so. So when it comes to drug screening, all we need to do is to select a cartridge. I'm just going to turn off my virtual background at the moment as well. Otherwise, we're going to lose what I'm doing. So all we have to do is to select a cartridge, and all throughout this process, the donor would be the only person doing this until we insert it into our reader, which I'll get to. We are a 3-part drug testing process, from drug screen in these small silver pouches to analysis through our drug screening reader, all the way through to laboratory confirmation of those results. Now, the reason we have laboratory confirmation is because no drug screening system worldwide is 100%. So we have to send this off for laboratory confirmation through LCMS to get a legally defendable result that your organization, your governing body can stand by and be sort of convinced that, you know, everything that we've detected here is indeed there. So it protects everybody throughout the entire process. Now, I'll walk you through the screening element, and then I'll hand you over to Pete, who's going to talk about our laboratory element as well. So to begin the testing, all we simply need to do is no specialist preparation. We can do this at any point, anywhere, at any time, which makes it incredibly easy. All we have to do is to ask a particular individual to hold up their hands and show them to us. Now, what we're looking for here is an open wound or a physical barrier. If either of those are present, we're not going to test that digit, and it's not going to slow us down. We take a total of 10 digits onto one cartridge when we're analysing a sample. So if I did have a wound on this thumb, for example, we'd simply take 2 from this. If I was missing my left hand, we'd do my right hand twice. If I was missing both, we'd do toe prints, but it's not that kind of webinar. I'm going to keep my feet under the desk. So to start off with, we do a quick check of that. And as I said, we're going to take a total of 10 fingerprints as a belt and braces approach to ensuring there's enough sample. We then go across to our cartridge that we've taken out of its silver pouch. Now, on this cartridge, you're going to see a number of things. If we think back to our COVID tests, where we all had to add a couple of droplets onto the strip, the lateral flow test, again, much like this, we've just sort of neatly packaged all those solutions for you within this buffer clip. Here we have an area, this sort of square paper pad. That's where I'm going to place a total of 10 digits in order to leave that sweat behind. We're all producing sweat. It doesn't have to be a hot day. It doesn't matter if it's a cold day. We're all going to be producing that equine sweat through our fingerprints. And I'm sure that 99% of people that are on the call today have got their phone sat on their desk beside them as they watch this. Now, that black screen, if you push down on that now, what you see left on that screen is the sample we're analysing. Next to that, we have this plastic slide. This goes across and locks into place after I've given my sample, ensuring that integrity that we spoke about earlier on. And then we have this black rectangle here. Now, within that black rectangle is where the control lines are produced, which is what our reader analyzes. If we think of a pregnancy test, again, another type of lateral flow test, we get that clear line or plus, and you smile or feel sad depending upon where you are in your life. We can't generate that clear line with this particular test. And that's simply because, well, sample size is very, very small. So we generate a fluorescent line, which is what is then analyzed within our reader to ensure, that decision is made correctly. On the back of each test, we have an RFID tag that's unique to each and every cartridge. It introduces it to our drug screening reader and also helps us with various aspects of chain of custody, such as not allowing us to run an out-of-date test, an expired test, not allowing us to run the same test twice. So I often think of this as a sort of digital expert in the room when it comes to analysing our samples. It's almost a third party here to protect the process for us, with various other benefits I'll get into. So you've checked my hands, we're good to go. Dirt, oil, grease, hand sanitizer, none of which have an effect on the test. We're not concerned around background levels of contamination, which I can answer if anybody has a particular query on that. We're just good to go straight away. So 2 seconds, straight into the process. Now, all you will ask me to do is to firmly push with each digit for 5 seconds onto this pad. Now, what you see when I'm pushing is a change of color in the fingernail or a crease in the knuckle. And that just indicates that I'm placing enough pressure in order to leave my sample behind. The only way to cheat this test would be if I sort of hovered over and didn't push down. But obviously, anybody can witness anybody do this. And from wherever you are sitting in the world, you can clearly see that I'm placing that pressure and adequately pleased that I'm doing this test correctly. So we do all 10, as I mentioned, belt and braces approach. It takes away any queries around interfinger sweat variability. Does my little finger sweat less than my index finger? So on and so forth. It's a consistent sample each and every time. And by layering 10 fingerprints on top of each other, there's no way of extracting a single fingerprint as a biometric. So there's no issues with that, as well as that being destroyed. No matter how much CSI you may or may not have watched, that's sort of covered off. There's no single fingerprint. I've slid this across, which is locked into place. That's protecting the integrity of the sample. And I could now hand this back to the person collecting it without any suggestions of contamination or anything such as that. The next step in the process is to hop along to our drug screening reader. Battery powered, making it very portable for testing anywhere, anytime, be it in mines in South America, Africa, to roadside drug testing in Italy, to workplace factory floors, construction sites, anywhere, sort of anytime. 8.5 hours of testing from a full charge. It puts itself into sleep mode when you're not doing so in order to sort of maintain that battery. On the screen, we have a number of different options for you, from single test for one sample, batch test for whenever we want to run multiple samples in a really time-efficient manner, review results, the RFID tag, time, date, stamps, the cartridge in the reader stores those results for you, so you have full traceability, which is password protected, so only the necessary people can access that information. and finally settings for small things such as time and date. Now, to run one single test as we're doing now, I would simply hit single test, and it asks me to press my buffer clip. Now, when I activate the test, you'll see a black liquid begin to pass across, which is dissolving and destroying the fingerprint, and we know that my test is good, started, and ready to go. I hit next on my screen. It asks me to insert my cartridge, which I do. And the RFID tag is going to introduce that cartridge to the reader. It's going to tell it which lot number it is. As we're a registered medical device, we like to record everything going through the process. It's going to tell it which testing panel we're doing, which is our workplace drug testing panel of cocaine, opiates, methamphetamines, and cannabis, the most predominantly used drugs in day-to-day society. And it's going to check that it's in date. So we're not using an expired product which can affect our chain of custody and anything like that. If I try and start my test now, it's not going to allow me to do so, which is another safeguarding feature to make sure we always have that traceability and those results are always going to tie back to a particular individual. So I put in a few details, I hit enter and I start the test and that begins to analyze. Now, for the first sort of 9.5 minutes or so of this analysis, my reader's not really doing anything other than timing my test, making sure that the antibodies have made their way across to the control lines and that the result is ready to be analysed. So much like waiting for urine, much like waiting for saliva, much like waiting for our at-home COVID test, which should have been for a similar time frame, but in reality, we all checked after 2 minutes and determined we were safe to go to the pub. Now, our reader is ensuring this is being done correctly. The correct time frame is being followed each and every time. So holistically, for one test, from start to finish, we're looking at no more than sort of 10.5 minutes. Now, that may seem like a long time for analysis. However, when we look at the process of collection, gathering the individuals, making sure they aren't cheating, are they able to adequately provide a sample, that time frame seems much, much shorter, and you can really see the efficiencies associated. However, on top of that, because of the lack of privacy concerns associated with fingerprint testing, what we can do is we can gather a sample from multiple people at the same time. You know, we don't need individual bays or individual toilet stalls, anything like that to witness it. So we can gather multiple samples at the same time. We can then activate them at the same time. So click the buffer clips at the same time. And we run the first one in a single test, but those subsequent ones through batch testing mode. And that's simply because we know the first one has, that time has passed by using the first one as our gauge in order to then be able to run the second one where the reader skips straight to the analysis. So that process is only 30 seconds. Really speeding the process up. So we're looking at 6 people tested well within 15 minutes. I personally travelled to a region in outback Australia in Queensland where I tested upwards of 150 people in less than an hour across multiple readers, which I would say is the fastest way to do drug screening worldwide. We know the process was done correctly. We know that the lack of downtime to that organisation was hugely appreciated. On urine, that's a 2-day process. On saliva, it's at least a day. On us, it's an hour. So there's a huge efficiency associated with that. Now, whilst my test sort of boils away, that is the drug screening process as a whole. So we can sort of loop back before the Q&A where I can show you my results. But really, I think it's a good time for me to sort of hand over to Pete at this point to discuss the laboratory analysis. And then I'll take any queries at the end.
Perfect. Thanks, you so very much. Yeah, sorry. Go ahead. Go ahead, Pete.
Go ahead,
Do you have
Jason.
a slide, Jason? Do you want to pull the slides back up?
Yes.
Yeah.
Give me 1 second here.
So essentially, as far as the confirmatory portion, right, if you test non-negative or positive, but we call it non-negative, then a follow-up confirmatory test is done, right? And this is very similar to other ways, other analytes of being tested in many ways, and I'll explain. Essentially, we have a cartridge, and Jason, do we have a picture of that cartridge?
It's on my screen, but it's not on this one. Give me 1 second here.
It looks very similar, if not identical, to the one that Doug just shared with you. The only difference is that there is no buffer clip. We're not doing any chemistry analysis. And all it is collecting your fingerprint as a sample. That is it. So it's a black PET, which is basically just a black film plastic. You collect it the same way you do a screening device with all 10 fingers to get a mass sample. And then you close it, lock it in for security reasons, and then ship that off to the lab. All that cartridge is doing is holding your sample to get to the lab for analysis. And then once it gets to the lab, it is analyzed very similarly to blood, to, thank you, Doug, to blood, to sweat, to saliva, and to urine. What I mean by similar is that it is used in a LCMS. It's called, it stands for liquid chromatography mass spectrometer. It's a long sentence, but essentially that is the gold standard. That is what, it's a quantitative number. Quantitative meaning it gives you an exact number as to where the drug is. When it is analyzed, it is used qualitatively. So essentially there is a cutoff line, and it will tell you if you are above or below that, essentially telling you if you have the drug in your system or not, per the drug. Now, the reason it's so important to use an LCMS is because it is the most detailed instrument in the lab to test for drugs. Like I said, is the gold standard for any analyte. The liquid portion of it is that you wash off the sweat into a little crucible, and then it is analyzed. So anything that is not already a liquid, obviously urine and blood and saliva are, so they just don't need to wash it off, they just use it. But sweat being a little bit more sensitive, we wash it off, use it in an LCMS, and then we get a result. Simple as that.
Perfect. Thank you so much, guys, for the overview of the entire process there. I think with that, it's a pretty good time for us to move into our Q&A session. We have a few questions here that were pre-submitted. Anyone on the call, please feel free to enter your questions now, and we'll answer them as we go. I think, Doug, you kind of touched on this earlier, but can you talk to us about the accuracy of the fingerprint sweat drug tests?
Yeah, of course. So the Journal of Analytical Toxicology would refer to sweat-based drug testing or fingerprint testing as in and around 99% inaccurate. However, drug testing accuracy levels set through clinical trials and medical trials, I believe, aren't sort of the correct statistics to quote, because people are given controlled substances and these tests are carried out in controlled environments. If I was a drug user, the substance I believe I'm taking may well not be the substance I'm taking, and they're sort of illicit, unregulated substances that chop and change. So fingerprint drug testing accuracy is in and around 95%, the same as urine and saliva. There's not one that's particularly better or worse than the other, which is a common myth. But we see that through our real world data with what's confirmed at our laboratory compared to what's screened positive. And I sort of harp back to the UK testing market, where we have the largest volume of sort of screened positives, negatives, compared to which are then subsequently confirmed at laboratory.
Excellent.
And if I can add on to that, Jason, thanks, Doug. Accuracy really should be, it's really three parts when you think of accuracy. If you may say, well, like, what does that really mean? It comes down to sensitivity, specificity, and then total accuracy of the product. What those words mean is sensitivity essentially tells us those who are actually using drugs and drugs are present in their system, how good is it at catching true positives? Then specificity is kind of the opposite. We're testing people that don't have drugs in their system, that are drug-free, and how good is it at avoiding false positives? And then it's the average of those that gives us the accuracy level. And as Doug said, 95+% accuracy. It could vary a little bit depending on the drug, only because the body metabolizes each drug a little bit differently.
Perfect. Thank you, guys. Next question here. Would you say that breath-based drug testing is smarter than fingerprint testing because it can be done without contact?
Yeah, so I'm happy to sort of answer this. Breath testing, as with all drug testing systems and drug screening systems, there are positives and negatives and pros and cons to it. Breath testing is very much in its infancy in regards to drug screening. And there's a very limited number of substances in which you can test for with it. As with fingerprint testing, it has an incredibly short detection window, much less than ours, to be precise. But there are sort of some queries over its overall validity and its accuracy still at this stage. These may well be proven as sort of more organizations take it up. and stuff. So it's another option to consider. And I think that workplaces need to have a variety of tools available to them. Sometimes a longer detection window is needed, sometimes a shorter one is needed. I think we sit in that perfect sweet spot, but I obviously have a pretty biased opinion as well, although I do honestly believe that. It's a very sort of high cost for implementation and a very complex device, which requires a lot of calibration. But it is, it's a non-invasive method of doing it. It's incredible. When I say that detection window is short, it can sometimes be minutes as opposed to hours for different substances on there. So it's really how you want to police it. So that's sort of my summary for it. I think there's a place for the technology, and it's always great to see another technology in the space sort of driving towards safer workplaces. But as with anything, there are sort of positives and negatives to the tech.
Perfect, thank you. This next one might be for Pete. What are the cutoffs, and how many analytes are tested in one cartridge?
So there's one. It's one analyte, so we're only testing for sweat. But I'm sure they mean, well, how many drugs are tested? And we test for 4 main drugs. So the categories are THC, as Doug mentioned, I think these before, THC, methamphetamine, cocaine, and then opiates. The cutoffs obviously vary per drug. Obviously, I can't state the cutoffs right now because that'll be a way more technical conversation. But the cutoffs are set so that, as Doug said, the window of suggested impairment, obviously, are going to fall above that cutoff, and below, they will not. Hopefully that answers the question.
Maybe we can go into the units of measurement. So,
sure.
Yeah, so the fingerprint test is obviously with such a small sample size, it's an incredibly sensitive. The test has a requirement to be incredibly sensitive to correctly detect anything there. I often look at the analogy I would use is if you're testing with something like urine, you're looking for a sample within a swimming pool, whereas with fingerprint sweat, we're looking for a substance in a shot glass. So the cutoffs have to be aligned accordingly, and the units of measure in which we detect those metabolites has to be aligned accordingly as well. So fingerprint tests are incredibly sensitive and can detect trace amounts of substances, with the cutoffs being set in picograms, which is a trillionth of a gram, so an incredibly sensitive method. But in relation to the sample size, it's all proportionate and correlates loosely with that of urine and saliva.
You mentioned earlier, Doug, about background contamination. Can either one of you guys comment on how that might affect some tests, if it does?
Yeah, you'd be looking at an enormous level of parent drug to trigger a positive result. There's been various studies sort of around this, and cutoffs set accordingly. If I was to dip my finger into a bag of cocaine and immediately do my test, I would be positive. But I would argue that if I was dipping my finger into a bag of cocaine in a workplace environment, you'd likely want to know about that as well. Things like cocaine on banknotes, cannabis resin on public transport, so on and so forth, aren't going to affect this test. Drugs are everywhere within society. I believe there's actually some shrimp in the River Thames in London, UK, that are technically high on cocaine due to a large amount of it on the sewage. But it isn't something that affects this test. If it was, because we don't advise sort of washing of hands before screening tests, what we would see as an organisation, and this is an enormous data set that I'm referring to, is an overwhelming number of non-negative screens subsequently being confirmed at laboratory as negative with 0 drug found. And that's simply not the case. We see much of what we confirm at screen, so we screen positive to being confirmed at laboratory. And there is a hand wash before the laboratory procedure to sort of unequivocally demonstrate that whatever's present in that sweat sample has come from within them. They've washed their hands, they've allowed sweat to reform without handling anything, they've done the test. So we can pretty confidently say that background levels of contamination have absolutely no issue on this test. And each and every year that we continue to operate the system in the way that we do, the data set supporting that becomes stronger and stronger.
Perfect. Next question here. Can you give us an estimated price per test?
Yeah, broadly speaking, and it changes from region to region depending on economic constraints and being competitive within the market. But we'll always be competitive with a premium saliva test, of course. Now, as I mentioned, we need to look at the process holistically as opposed to the individual unit cost. The list price in the UK is in and around £16. In the US, forensic use only market, it's in and around $15. And we sort of set prices accordingly. Now, I can happily have conversations with anybody on an individual basis around their particular region, refer them to a distributor within their particular region, or if there is an interested party on the call that wants to be a distributor, we can certainly look at pricing in more detail, but competitive with Saliva. And I mentioned sort of some costings on there as well.
Excellent. One question here. So how do we measure and measure impairment if it's measuring only small quantities?
It just boils back to the detection window, really. We're only looking over sort of 16 hours, which is recent usage. How much of a substance are you happy for someone to induce in the last 16 hours and be within the workplace would be sort of my question. And it's the same as any other drug screening device worldwide. You know, as I said in the webinar earlier on, there is no system worldwide that tells you that somebody is impaired. That's down to medical review to do so. So we believe that the more recent you consumed that substance, the more likely you are to be impaired at that given time, with the analogies I used before. But it is that high suggestion of impairment, which is important to say. You know, it's a high suggestion. There is no system that will categorically say you are, but we believe there is a higher suggestion of impairment when you know that that individual has consumed a particular substance recently.
Perfect. One more question here. Can a person be verified after a week's use of drugs? I think that what this person is asking is someone has taken some kind of substance 1 week ago. That's outside of our detection window, though, as you were mentioning, Doug. Is that right?
Yes, correct.
Mm-hmm. Mm-hmm. Okay. One more question here. Sorry. Can you talk about medical cannabis?
Yeah, I mean, as I mentioned, we're here to define the presence of a metabolite above or below a particular level. We're not here to say how that particular metabolite found their way into that individual system, and there isn't a system worldwide that can do that. So for cannabis, we detect THC, which is the psychoactive element of cannabis. And I'm sure Pete may remember the full name for THC, but I'm not going to put him on the spot. It
is something like tetrachlorobil or something.
There's a hydro in there somewhere. That's the bit that gets you impaired. Now, if that's present within medicinal cannabis, we're as likely to detect that within our detection window as any other drug screening matrices is likely to detect it within their particular window. I think the shorter window there means that we're only going to detect recent usage of medicinal cannabis, whereas with something like a urine sample, if someone was legally taking medicinal cannabis over a period, they would be positive for months, and therefore it would be difficult to determine their fitness for duty in the workplace. But yeah, if THC is present, we're going to detect it in the same way we would detect cocaine if I had chosen to ingest that substance, or if I had been spiked with that substance. The same way we will detect a dosage of a non-synthetic opioid if it was a prescription or if it was heroin. Our job is to detect that metabolite above or below a cutoff within our detection window, not to ascertain how that particular substance got there. That's for drug screening as a whole. It's not unique to fingerprint testing.
Excellent. Next question here is the test FDA 510K.
So the test, we are working towards a 510K submission. We have done a submit. We submitted and got some great feedback from FDA and clear direction as to what we need to do and what gaps we need to fill. We are currently working on that as we speak, and we're planning on moving towards that in Q2 next year.
Perfect. Thank you. One more question here. During testing, Should the instrument be on a flat surface and not be subject to vibration? One case during measurement, my customer was picking up or shaking the instrument, causing an error in the analysis. How can we solve this?
Yeah, look, we have our instructions for use on the system, and we will stand by the results if these instructions are followed. So we would advise not to pick up and shake the instrument when you're using it, because we haven't tested that in the same way as we haven't tested whether it will work if you throw it out the window midway through it. So let's try and use the system correctly. We are a registered medical device. It's a sensitive piece of equipment. So if it's doing its analysis, we like to keep it in one place and safe. I don't advise shaking it around, as I wouldn't advise with any particular piece of technology in this arena either.
Perfect. And one final question that we have here, what is the confirmation on the non-negatives through lab? So can you talk us through, after the test is done, what the process looks like on a non-negative result?
Yeah, I mean, it's very similar indeed to the first part of the screening process. There's no reason to have an easy to use, simple system at the beginning and then a convoluted, difficult second part through a different matrices. So we do this through fingerprint sweat again. The individual is asked to wash their hands with soap and water to fully remove the sweat from it. And then they wait 15 minutes for that sweat to reform, showing that without handling anything, meaning that anything that's present within that sweat has only come from within themselves. They provide a sample onto our fingerprint cartridges, much the same way, which are sealed, entered into a tamper-evident bag and sent off to laboratory for analysis. Now, the process at laboratory analysis is through LCMS, as Pete touched upon earlier on in the call, highly accurate and will give us a quantitative result as to what's there. If it was an opiate positive, it won't simply come back with an amount of opiates. It will tell you which particular opiate was there. So was it heroin or was it codeine? If it was cocaine, we'll confirm both cocaine and benzodiazepine, NBZE, which is a substance my liver only produces when I've consumed cocaine. So we learn a little bit more through this. I think they just asked the actual confirmation rate as opposed to the lab process. The actual confirmation rate was what I was discussing when I was talking about accuracy earlier, which is upwards of 95%. So, and I think that's the real sort of important rate, as what's been screened and what's been subsequently confirmed, because that's what's of issue to any sort of commercial business. We don't want to be suspending people and then subsequently reporting the results as negative. So we operate numerous labs around the world, from the UK, US, Chile, South America. We're in the process of opening a couple of more labs in Europe, in addition to the one that we have in Italy. And we also have a laboratory here in Australia as well. But I think
Excellent.
I managed to cover off all the question there for Oza.
Yeah, I think so. Perfect.
Awesome.
Well, thank you guys so much for all of your insights. Thank you everyone for your questions. I think that's all the time that we have today. To end our session, I think we'll just really encourage everyone on the call to take a look at your drug and alcohol policy and consider what your goals are, and consider using a modern testing method like fingerprint drug testing. I'm sure that Doug and Pete are happy to answer any questions or happy to get in contact with anyone that's interested in seeing what this looks like in their particular workplace. We'll be sending the recording to everyone shortly, and we'll have our contact information on there for anyone that's interested in continuing the conversation, or I'll throw that up on there as well for anyone that wants to get into contact with us right now. Once again, we thank you all for the time that you've taken out of your day to join us today. Thank you so much to Doug and Pete for your incredible insights, and we hope to see you all again soon.
Thank you very much for joining, everyone. I appreciate you taking the time. Take care.
Thanks, everybody.
Bye-bye.